Dear colleagues, it is often difficult to imagine what is more difficult than one crisis. The response is, however, straightforward. Two crises happening at the same time. We have been, unfortunately, been increasingly used to crises such as disease outbreaks, armed conflicts, natural disasters, and many more happening during the last years and affecting the outcomes of each other. This is what the international community has already coined as a syndemic or a permacrisis, and this is what institutions have urged for addressing as one in terms of studying, understanding, and acting upon this. One of the efforts that aim towards understanding cancer and crisis as one and delivering resources, solutions, and knowledge in this intersection is the Institute of Cancer and Crisis that I am happy to present to you today. My name is Christos Tsagkaris. I am a medical doctor and I serve on the board of the Institute of Cancer and Crisis. We usually start a presentation by providing an introduction and close it with the take-home messages. However, the situation is so grave that we will have to start the other way around by making sure that we are all on the same page. And the key sentence on this page is that conflict is, among others, a cancer care catastrophe. It has several known as well as hidden impacts. We might think directly on the displacement of populations and also on the displacement or even loss of competent healthcare workers and patients, but we should not also forget that in the long term, the destruction of infrastructure, the intergenerational, oftentimes psychological trauma, and the spread of environmental carcinogens are long-term effects of a crisis and notably an armed conflict on cancer prevention and control in a region for years to come. What we need in order to tackle this, we need innovation, but we need the kind of innovation that prompts solidarity and acts in accordance with international and humanitarian law in order to ensure that in the same way that cancer doesn't cease fire, our efforts to tackle cancer in peace and war alike do not cease fire as well. For this reason, the mission of the Institute of Cancer and Crisis lies in empowering patients, advancing research, and providing comprehensive resources to navigate the challenges associated with cancer and other life-altering conditions. How did this all started? On the top of this slide, we are seeing a nice and peaceful picture from the so-called Jonction. This is the junction of two rivers near Geneva, the capital of global health. But what we are seeing at the bottom of the picture is a junction as well, a junction, but a way more alarming one. If we take some time and take our memory back to 2020, it's spring, the first months, February and March, we will of course all remember the COVID-19 pandemic unfolding across the world. And if we dig up a bit more in our memory, we might remember news titles about an armed conflict between the countries of Armenia and Azerbaijan for the territory of Nagorno-Karabakh in Central Asia. And this was exactly what prompted the founders of the Institute of Cancer and Crisis at the time, Dr. Yeva Magarian and Professor Georg Tamamian, to put together a platform that would create evidence-based knowledge and would propose, and to the extent possible support, evidence-based action to support cancer patients in this territory and potentially in the future in other territories experiencing similar situations. Because the way that one should act here is first of all sharing experience and knowledge and building synergies that will allow to collect these in a reliable manner in order to establish common strategies for adequate cancer care during crisis. The effort started at the local level, but soon after expanded as a team of 18 members with specializations in clinical medicine, oncology, regulation, public and global health, to mention a few, that still serve as the board of trustees and directors of the institute. The board has been, of course, complemented and supported by a worldwide team of young professionals and volunteers that conduct research and support the events and the activities of the institute. And if we take a step back and imagine what should be happening in emergency care in an emergency scenario, we all know that at an individual level, before doing any life-saving intervention, we need to ensure that the field of action is secured and safe for the individuals that provide life-saving care. This is a principle of trauma life support across the world. What happens, however, if we try to translate this principle at a broader humanitarian and oftentimes global context? Safety or a secured perimeter is not anymore a geographical or not only geographical, but most importantly, an intellectual space. We need therefore research and evidence that describes the situation effectively and also outlines correct and benevolent action in order to tackle the compounding effect of cancer and crisis. To this end, the Institute has begun its work with a number of studies, either reporting or analyzing existing knowledge on the impact of conflict, either at the local level or in general on cancer, focusing on a wide set of cancer-related outcomes, either crude outcomes related to the disease, but also broader biopsychosocial outcomes and determinants of cancer prevention and control. This resulted into the first global summit on war and crisis back in December 2023, that in turn produced what was later known as the Manifesto on Improving Cancer Care in Conflict-Impacted Population. This document reflected on the shared knowledge, experience, agony, and vision that was collected by a number of experts that joined the conference and was at the time co-authored with, among others, the director of the World Health Organization. What, however, has this research shown? What kind of knowledge has been delivered? Every conflict is unique, every person in a conflict is unique, every cancer that affects a person in a conflict-affected area is unique. However, there are some common learnings. One of them is that conflicts lead to disruption of transportation of people and goods. This means that on one side, both patients, caregivers, and healthcare workers may be unable to reach the sites of care, and on the other side, when we refer to the transportation and mobility of goods, we have life-saving medication and equipment that might not be able to arrive at all or on a timely manner or in an integral manner, meaning that medicines whose supply chains are disrupted may lose their biological activity, rendering themselves useless. And of course, it's not only about cancer. Cancer is just the beginning. We have comorbidities on people with cancer because we should not forget that people are holistic entities. They are not diseases and they are not organ systems. And further research that was presented in the World Cancer Congress in Geneva in 2024 showed significant challenges in daily activities, cognitive function, as well as high levels of fatigue and financial distress. This urges once more for a whole person approach. And speaking of a whole person approach, it's not only biology, it's also participation to social activities. And in any place of the world, including the four countries that were included in the subsequent studies, this is linked to financial means or to the lack thereof, the so-called financial toxicity, which is the situation where healthcare expenses can lead to significant deterioration of the standard of living of a person. This happens that is something that is already known among cancer patients and among conflict affected populations, and unfortunately it's something that may aggravate when we have an intersection of both of them. In this study, there was therefore an analysis of lived experience of financial toxicity and its impact on mental health, with two reliable and validated tools for this person that, despite the variations at the national level and the diverse local co-founders, the countries that have been mentioned have experienced conflict in different settings and in different parts of their recent history, showed a clear connection between financial toxicity and psychological distress. Cancer patients living during a conflict are depleted not only of care or healthcare in total, they are also depleted of their financial means, and this can lead them to further or to a spiral of psychological distress that in a vicious circle will most likely affect all the other parameters that have been aforementioned. What is next? Expansion is next, in the same way that unfortunately conflicts are expand and tensions are expanding across the world in the last years. We also need to make sure that our activity and our knowledge is comprehensive and can be gradually become available and adapted to the needs of different populations. The Institute has, since some years, actively engaged with global actors, including the World Health Organization, in order to foster efforts for the integration of cancer into crisis. While more is to be announced, I would like to address your attention towards the forthcoming second Global Summit on War and Cancer, where the Institute is closely working with the WHO to put together an event that will most likely take place in spring 2026 in Egypt. We invite you to attend the event, to engage with its outcomes, and certainly to engage with the work of the Institute, or to make sure that you are not forgetting and that you are also focusing your efforts on the impact of conflict, not only on cancer, but also on the diseases that you are seeing in your practice, that you are researching in your laboratories, or that you might be experiencing in your broader social surroundings. I would like to thank you all for your attention and especially acknowledge Dr. Gemma Arakelian, the current CEO of the Institute, for her support throughout our work and also for providing material for this presentation. This stated, I'm available for questions either now or later, either through the chat or by email. Thank you for your attention.